chronic, potentially life-threatening condition caused by the human immunodeficiency virus. By damaging your immune system, HIV interferes with your body's ability to fight the organisms that cause disease. HIV is a sexually transmitted infection. It can also be spread by contact with infected blood or from mother to child during pregnancy, childbirth, or breastfeeding. It can take years before HIV weakens your immune system to the point that you have AIDS. There is no cure for HIV/AIDS, but there are medications that can dramatically slow disease progression. These drugs have reduced AIDS deaths in many developed nations, but HIV continues to decimate populations in Africa, Haiti, and parts of Asia. Symptoms. The symptoms of HIV and AIDS vary depending on the phase of the infection. A primary infection. Majority of people infected by HIV develop a flu-like illness within a month or two after the virus enters the body. This illness, known as primary or acute HIV infection, may last for a few weeks. Possible signs and symptoms include fever, headache, muscle aches, rash, chills, sore throat, mouth or genital ulcers, swollen lymph glands, mainly on the neck, joint pain, night sweats, diarrhea. Although the symptoms of primary HIV infection may be mild enough to go unnoticed, the amount of virus in the bloodstream is particularly high at this time. As a result, HIV infection spreads more efficiently during primary infection than during the next stage of infection. Clinical latent infection. In some people, persistent swelling of lymph nodes occurs during clinical latent HIV. Otherwise, there are no specific signs and symptoms. HIV remains in the body, however, in infected white blood cells. Clinical latent infection typically lasts 8 to 10 years. A few people stay in this stage even longer, but others progress to more severe disease much sooner. Early symptomatic HIV infection. As the virus continues to multiply and destroy immune cells, you may develop mild infections. Progression to AIDS. If you receive no treatment for your HIV infection, the disease typically progresses to AIDS in about 10 years. By the time AIDS develops, your immune system has been severely damaged, making you susceptible to opportunistic infections, diseases that wouldn't trouble a person with a healthy immune system. Causes. Scientists believe a virus similar to HIV first occurred in some populations of chimps and monkeys in Africa, where they are hunted for food. Contact with an infected monkey's blood during butchering or cooking may have allowed the virus to cross into humans and become HIV. How HIV becomes AIDS. HIV destroys CD4 cells, a specific type of white blood cell that plays a large role in helping your body fight disease. Your immune system weakens as more CD4 cells are killed. You can have an HIV infection for years before it progresses to AIDS. People infected with HIV progress to AIDS where their CD4 count falls below 200 or they experience an AIDS-defining complication such as pneumocystis pneumonia, cytomegalovirus, tuberculosis, toxoplasmosis, cryptosporidiosis. To become infected with HIV, infected blood, semen, or vaginal secretions must enter your body. You can't become infected through ordinary contact with someone who has HIV or AIDS. HIV can't be transmitted through the air, water, or through insect bites. Cancers common to HIV/AIDS: Kaposi sarcoma, lymphomas. Test and diagnosis. HIV is most commonly diagnosed by testing your blood or saliva for antibodies to the virus. Unfortunately, it takes time for your body to develop these antibodies, usually up to 12 weeks. In rare cases, it can take up to 6 months for an HIV antibody test to become positive. A newer type of test that checks for HIV antigen, a protein produced by the virus immediately after infection, can confirm a diagnosis within days of infection. An earlier diagnosis may prompt people to take extra precaution to prevent transmission of the virus to others. There is also increasing evidence that early treatment may be of benefit. Tests to tailor treatment. We have the CD4 count, viral load, drug resistance. Drugs. There is no cure for HIV/AIDS, but a variety of drugs can be used in combination to control the virus. We have the non-nucleoside reverse transcriptase inhibitors, the nucleoside reverse transcriptase inhibitors, the protease inhibitors, entry or fusion inhibitors, and then we have integrase inhibitors. Coronaviruses are a large family of viruses that cause illnesses ranging from the common cold to more severe diseases like SARS, that's severe acute respiratory syndrome, and MERS, Middle East respiratory syndrome. COVID-19 is caused by the novel coronavirus SARS-CoV-2, first identified in Wuhan, China, in the late 2019. The structure of the virus. SARS-CoV-2 is an envelope positive sense single-stranded RNA virus. It has spike protein which facilitates entry into host cell by binding to ACE2 receptors. It has envelope protein that plays a role in virus assembly and release. That's a membrane protein which maintains shape and structure of the virus, and it has nucleocapsid protein which binds to the RNA genome and helps in replication. Mode of transmission. Primarily spreads through respiratory droplets from coughs, sneezes, or talking. Can also spread through contact with contaminated surfaces and, in some cases, airborne transmission. Asymptomatic carriers can also transmit the virus. Symptoms of COVID-19. The common symptoms are fever, dry cough, fatigue, loss of taste or smell. Other symptoms, we have sore throat, muscle aches, headache, chills, and shortness of breath. Severe cases may lead to pneumonia, acute respiratory disease syndrome, ARDS, organ failure, and death. Now, incubation period is typically 2 to 14 days after exposure, with symptoms most often appearing around day 5. Diagnosis. PT-PCR reverse transcription polymerase chain reaction test detects viral RNA. Antigen test detects viral proteins. Serological test check for immune response to infection. Now, prevention and control. Wearing face masks and maintaining physical distancing, regular hand washing and use of hand sanitizers, disinfection of frequently touched surfaces. Vaccination is crucial to building immunity and reducing spread. Now, treatment. Mild cases, symptomatic treatment. That's rest, hydration, fever reducers. Then we have severe cases where there will be hospitalization with oxygen therapy, corticosteroids, antiviral drugs, and ventilator support. Monoclonal antibody treatment may be used for early stage infections. Now, vaccines. Multiple vaccines developed globally include mRNA vaccines, viral vector vaccines, and inactivated virus vaccines. Vaccines reduce risk of infection, severe illness, and transmission. Variants arise due to mutations in the viral genome.